Hello, everybody. My name is Anna Sureda. I am the head of the clinical hematology department at the Catalan Institute of Oncology in Barcelona, Spain. And I will be discussing with all of you the risk of T-cell lymphomas after CAR T-cell therapy. So I'm sure that you will remember that at the end of last year, December 2023, we received a notification coming from the FDA indicating the existence of several cases of T-cell lymphomas in patients that had been treated with CAR T-cell therapy. And that applied not only to autologous CD19 CAR T-cell constructs, but also to autologous anti-BCMA CAR T-cell constructs. And of course, this information coming from the FDA raised quite a lot of concerns, not only in the scientific community, but also in patients that had been treated with these constructs and in patients that were going to be treated with these constructs. Of course, when we start using a new treatment strategy, we have to take into consideration side effects and the development of secondary malignancies, and specifically T-cell lymphomas can be considered side effects not only of CAR T-cell therapy, but of course of other type of treatment strategies that we have been using for many years. So chemotherapy, radiotherapy are associated to the development of secondary malignancies. Also, stem cell transplantation is associated to the development of secondary malignancies, and CAR T-cell therapy is an additional treatment strategy that patients received after having received a few lines of treatment before. So, two specific considerations. First of all, it's always very important to dissect which is the impact of a treatment strategy in the development of this case, in this case of secondary malignancies, and which is the potential impact that the development of a secondary malignancy has had with respect to the treatment that the patient has received before. Another important thing to take into consideration is that the number of patients that have had secondary malignancies after CAR T cells is very low in comparison to the number of patients that have received CAR T cells nowadays as March 2024. And of course, when we are evaluating side effect or secondary side effect of a given treatment, we have to balance in one side the benefit of the therapy and of course the side effects of this given therapy. And at least for the time being, the expert opinion is that the benefit of CAR T-cell therapy, both in patients with lymphoma and with multiple myeloma, is clearly superior to the potential side effects, including secondary malignancies. And finally, what I want to mention is that, of course, when we talk about T-cell lymphomas in therapy that basically genetically modifies the T lymphocytes of the patient, we have to have very clear ideas that the CAR transgene has been included in the genetic material of the secondary malignancies. And this issue was not demonstrated in the first cases that were published or presented by the FDA, and it has not been demonstrated in several cases that were analyzed before. What the scientific community is doing to try to better understand that, both the CIBMTR registry, which is the American registry, and also the EBMT registry, which is the European registry, have started to analyze the number of secondary malignancies that have been reported in patients being treated with CAR T. From an EBMT point of view, this analysis is still ongoing, but what we know from all these analyses that have been done is that the numbers are really very small. So it's important to follow up these long-term or mid-term side effects. It's very important to study as much as possible these cases to better understand which is the relationship between the development of the secondary malignancy or eventually the T-cell lymphoma with the CAR T-cell therapy. And of course, I think that this finding highlights the importance of the pharmacovigilance in this specific situation.